Hey, NBC evening. I hope you're doing great. I asked for a little forgiveness today. I'm feeling a little under the weather. I have a headache. But what I'm going to be attempting to do, hopefully successfully, is I'm going to read through chapter 25 slides. I've already put up you guys' little outline that you like to look at, and hopefully you got your chapter read yesterday with your exercise. So here we go. Okay, we're going to open up our slides. Oh, what happened? Where'd they go? There they are. All right, chapter 25, Pathology and Lab. All right, the Pathology and Laboratory section of the CPT manual is formatted according to the types of the tests that are performed. And we have a whole list of subsections such as organ or disease-oriented panels, drug assays, therapeutic drug assays. I'm not going to read through every one of those. That slide is there for you to take notes off of if you want to. But those are some examples of the types of tests that you're going to be found. And I'll say once again, Path and Lab section of the CPT manual is formatted according to the types of tests that are performed. Okay, the services in the Pathology and Laboratory section include the laboratory tests only. The collection of the specimen is coded separately from the analysis of the test. Per the example, if a patient had a clinic lab technician withdraw blood by means of venipuncture of the finger and the sample was analyzed in the lab, you would use code 36415 for the venipuncture, in addition to a code to report the test performed on the blood. For Medicare, you would use G0001 for Medicare. And then I'm just going to read down at the bottom, Medicare fee schedule each year identifies those tests, lab tests associated with the physician component, where you would be using modifier 26, which means professional component. Laboratories have built-in indicators that allow additional tests to be performed without a written order from the physician. These standards are set by the medical facility. Indicators imply that if a test is found positive, it is assumed that the physician wants more information on the condition. If a routine urinalysis is performed, a culture is performed if the test is positive for bacteria. So that's important to know. If a routine urinalysis is performed, a culture is performed if the test is positive for bacteria, because they have to figure out what sort of bacteria it actually is. Guys, I'm not putting exact page numbers because Rachel has a different book and it's just confusing. So just follow along in your books as best as you can. Because this is a recording, you can pause to find your place in your chapter. Pathology laboratory caution. The only CPT modifiers used in this section are 90 and 91. The CPT manual lists the drugs most commonly tested for, although the use of codes is not limited to the drugs listed. The modifier 51 is not used with pathology or laboratory codes. Instead, each test is listed separately. I don't know what this little shadow is. It says, please move this window away from shared application. I don't know what that means or what that is. I don't know if y'all can see that little shadow up there, but Okay, organ or disease-oriented panels 80047 through 80081. Codes in this subsection are grouped according to the usual laboratory work ordered by the physician for the diagnosis of or screening for various diseases or conditions. Groups of tests may be performed together depending on the situation or disease. For example, basic metabolic panel, general health panel, and the electrolyte panel. So we're going to talk about the rules of panels. All tests in the panel description must have been conducted if the coder is to code that for that panel. If the entire panel is not completed, you would code each test separately. Okay, I'm going to read the slide exactly. All tests must have been conducted and be medically necessary. Do not use the modifier 52, reduce service. Additional tests over those in the panel reported separately. If all tests in the panel are not performed, you're going to list each test separately. Do not use the panel code. So, if you don't use all the tests that are listed in the panel, you cannot use that panel. You have to code them individually. Drug screening Drug screening is an analysis which identifies the presence or absence of a drug. Code this carefully. Understand that you can code the number of procedures performed, not the number of drugs being tested for. So it's divided by 3 methods. Optical observation, 80305, instrument assisted, 80306, and instrument chemical analyzers, which is 80307. And it identifies the presence or absence of drug. Chromatography is a procedure in which single or multiple drugs are identified. Reports chromatography procedures, screenings is presumptive, and report 80307 for this. The thin layer chromatography drug screen is presumptive for single or multiple drug class method per date of service and is reported with an 80307. The drug screening codes only tell if the drug is present, not the amount of the drug present. I'll read it one more time. The drug screening codes only tell if the drug is present. It does not tell us the amount of the drug present. So now we're going to move into therapeutic drug assays. Drug assays test to detect a specific drug and to quantify the amount that the drug is present. What does quantitative information determine? The presence of a drug and the exact amount present. A coder should have a drug reference, example, a Moby's drug consult, handy to look up generic names of drugs that are listed by brand name in the medical documentation. And drugs in the CPT manual are listed by generic, not brand name. So it would be handy if you had a Mosby's drug consult, but you can also just Google that. So you need to remember that in the CPT manual, the drugs are listed by generic, not brand name. So evocation, suppression drug testing, 80400 through 80439, measures stimulating, evocative calling forth a response, or suppressing agents. Codes report only TC of service. Modifier TC is the technical component. The testing is performed to measure the effects of stimulating, evocative, or suppressing agents on chemical constituents. Do you know which codes are used to report supplies and drugs used in testing? Which code is used if the physician administered the agent? Which code is used to test involved prolonged attendance by the physician? Those are important things to know, and you'll find those in your chapter. If the physician supplies the agent, you're going to use code 99070. If the physicians administered the agent, refer to code range 90760, 90761, 90772 through 90775. And if the test involves prolonged attendance by the physician, you use the appropriate E&M code. So those questions that I asked on the slide before, they're found in your chapter, but I also just gave you the answer. We're going to talk about consultations. So 80500 and 80502, clinical pathology. This is at the request of the physician, additional information about the specimen, and consultant prepares a written report. There are levels. There's limited, without review of the medical record, and then comprehensive is with the review of the medical record. Consultation codes are found in the surgical pathology subsection, 88321 through 88334. It's used when the pathologist either reviews slides, materials, or reports, and he provides a consultation during surgery. It's reported on specimen, block section, cytology, exam. I'm going to talk a little bit about pathology terminology. So a specimen is a sample of tissue of a suspected area. A block is a frozen piece of a specimen, and a section is a slice of the block. So for example, a pathologist consults during surgical procedure and examines one block, which is 88331, and examines each additional section of the same block is 88332. So now we're going to talk about urinalysis. Okay, so test on urine. The method of test can be by tablet, reagent, or dipstick. Reason for the test could be pregnancy, for example. Constituents being tested for, bilirubin or glucose. What are 6 things for the coder to remember when he or she is coding urinalysis and chemistry subsections? So here are the 6 things. The identification of specific tests, whether the test is automated or non-automated, the number of tests performed, the identification of combination codes for similar types of tests, and whether the results are qualitative or quantitative, and the method of testing used. So your analysis, you need to pay attention to the equipment used, whether it's automated or non-automated, or with or without microscope, and you need to be aware of how many or the number of tests performed. The codes for the chemistry subsection are 82009 through 84999. Specific tests on any bodily substance can be urine, blood, breath, or feces. Most chemistry tests are quantitative, which is specific amount, unless specified for qualitative. Okay, samples from different sources reported separately. For example, if you tested blood and feces, those are going to be separate samples. Samples taken at different times of the day are reported separately because they're a different time. If blood was drawn to check a potassium level at 8 a.m. and again at 2 p.m., would both of these tests be billable? Yes, because even though it is the same test performed twice, they were performed at different times of the day. So you can bill both of those tests. Molecular pathology, 81105 through 81383 are Tier 1 procedures that report molecular assay. There are more common gene-specific procedures. For example, breast cancer gene 81162 are BRCA1 and BRCA2. 81400 through 81408 are Tier 2 procedures to report less commonly performed analysis. And 81479 reports unlisted molecular pathology procedures. So we're going to talk about hematology and coagulation. So laboratory procedures on blood, for example, complete blood count, which is CBC, or white blood cell count, which is the WCB. Codes divided based on method of blood draw, testing being conducted. So this is a figure of a Emerald 22 hematology analyzer. This is where they put that blood in, and I think it shakes it, or you can do all kinds of different things with this newfangled machine. Yes, I said newfangled. I think sometimes they can take blood from your finger and put it on a little strip and put it in there, and it gives them all kinds of information, as well as larger blood samples. So immunology, 86000 through 86804. Identify immune system condition caused by antibodies and antigens. For example, hepatitis C antibody screening, or tissue typing. 86805 through 86849 is a basic assay, screening, and typing. So we'll talk a little bit about tissue typing. 86805 through 86849. Compatibility test on tissue, match donor to recipient, and measure or monitor cytotoxic reactions. Okay, so now we're going to talk about transfusion medicine. This subsection deals with tests performed on blood or blood product. Their blood bank codes, tests performed on the blood or the blood products, do not identify supply of blood, but collection, processing, and typing. So we're going to talk about microbiology. Microbiology deals with the study of microorganisms and includes the following: bacteriology, mycology, parasitology, Virology. So bacteriology is the study of bacteria. Mycology is the study of fungi. Parasitology is the study of parasites. And virology is the study of viruses. Okay, microbiology caution. Culture codes need to be read carefully because some codes are used only to detect the presence of an organism, and others show additional sensitivity testing to determine which antibiotic would be best to use for treatment. There are many code descriptions similar to those in immunology, 86000 through 86849. The difference is the technique that is used. Anatomic pathology. These are post-mortem exams, and they deal with examination of the body after death, which would be autopsies. Autopsy codes are divided by gross exam only or gross and microscopic. These are further divided on what the autopsy consists of. For example, an autopsy with gross and microscopic exam with brain and spinal cord is 88027. Okay, so anatomic pathology are postmortem examinations, which are autopsies, reports only physician service, and codes divided on the extent of exam and type of exam, gross versus gross and microscopic. Cytopathology deals with laboratory work performed to determine whether any cellular change has occurred. Most common code is the pap smear. The codes are divided on type of procedure and the technique used. Oh, sorry guys, I went too far. Okay, so cytogenetic studies are 88230 through 88299. Cytogenic studies include tests that are performed for genetic and chromosomal studies. So it's a branch of genetics concerned with cellular abnormalities and pathological conditions, for example, chromosomes. Okay, surgical pathology, 88300 through 88399. These codes are concerned with the evaluation of specimens to determine the pathology of disease processes. Pathology testing is performed on all tissue removed from the body, and the codes 88300 through 88399 include assessing them, examination of the specimen, and reporting the findings. The unit of service for these codes is the specimen. Did it again, sorry. The diagnosis for the operative procedure is taken from the pathology report if pathology is performed. If a patient had a chronic cough and the operative report was billed as a chronic cough, but later the pathology report comes back as pneumococcal pneumonia, the cough was just a symptom of the pneumonia, which is why you should always wait for the pathology report. If two specimens from the same area are received and examined, each specimen is coded. So what is a specimen? It's just a tissue. It's just tissue that's been submitted for examination. The number of specimen equals the number of units. So unit of measure, 88300 through 88309, which is a specimen. For example, 2 anus tags, each are examined, would be 88304 times 2, One anus tag examined in 2 different areas of tag is an 88304 because it's still the same tag. It's just one. Types of pathologic examination. Microscopic means with a microscope. Gross means without a microscope. 88300 is only gross exam code, and others gross and microscopic. Okay, in assigning the code correct in the 6 levels of surgical pathology, the coder must identify the source of the specimen and the reason for the surgical procedure. The higher the level of surgical pathology, the more complex the examination, which means the more money. Okay, it's based on the specimen examined, for example, breast, prostate, lung, and the reason for the evaluation. Radical procedure for suspected carcinoma. Surgical pathology is divided by the area of the body and the complexity of the procedure. For example, 88305 is a colon biopsy. 88307 is colon segmental resection other than for tumor. And 88309 is colon total resection. So you went from the lower level code, the 05 for a biopsy, and then all the way to 09, which is a total resection. Okay, knowing these different levels makes coding for surgical pathology easier. So I am going to let you read through these levels and make notes. It's going to make coding in this section so much easier. Always look under the code in the CPT manual to find if the specimen and the surgical procedure fall there. So you need to make notes. You need to highlight in your book where you find these levels and make sure you have a good understanding. Not included in codes 88300 through 88309. Additional services codes are not included in these codes. Examples, special stains is 88312. Additional services are reported separately. That's the end. I hope you guys enjoyed our little slide presentation. I hope you have a great day. And we will be planning a Zoom meeting this week. I know that today's Tuesday, but I will get with you guys this afternoon to tell you when we're going to have that scheduled so we can do some coding together. Please let me know if you have any questions or you need any help. Thank you. Have a good day, guys.